name is Vila. I am at Carnegie Institute of Medical Sciences, and I would like to share with you a project that I have worked in, namely inpatient care in quality and control project. So I have participated in cycle 3 of this project, which has the goal of improving inpatient care as a credit service. So when we thought of how we can approach clinical practice, we took an approach of classifying 4 domains in the clinical practice. So all the blogs and online portfolios that you guys upload, we assess them based on these 4 domains, namely history taking, physical and clinical examinations, lab and imaging data analysis, and comprehensive analysis of whatever clinical data you have gathered. Based on these 4 domains, you will be graded from 0 to 4 in each of these domains, and be given a cumulative score for your online portfolio. We have taken this data and tried to plot it across time to observe changes and notice lapses in performances so that we can improve the medical care. So what you see here is the raw data of our cycle 3 of the project. Here we can see the scores awarded to each portfolio and each category. This category namely is for history taking, and this is for clinical analysis, this is for lab and imaging, and this is for comprehensive analysis, as you can see. What I did was I processed this data and put them into meaningful statistical terms such as cumulative means, average means, and etc. Then I represented the data in relevant charts and tables, which I am going to show in a moment. So as you can see, in cycle 3 of our quality improvement project, we took the intern batch of the year 2016. So in 2021 we got, and 2022, throughout the year, we got a total of 47 online portfolios. And here you can see them spread across each month. We see a spike in April of 2022 and also November of 2021.
So what would explain this spike?
Most probably, actually, in our previous cycle, we were impacted by COVID, so we did not get many cases and did not have many online portfolios to assess.
Look at the month. April to the grade. April to the, I think you were having an exam?
Yes, sir. Yeah. Maybe that is the reason.
Yeah. So during the exams, everybody is mandatorily having to do this portfolio. You know, the cases. And then the exam is going on, you are presenting it like this only. In the exam, you present your case in this online blog. And that's the reason there is a spike. Everybody is accumulated at that time.
Yes.
So, but then I'm surprised only 47, or is it that you just chose to sample 47? Because you are 150 batch.
Yes, sir. We actually, I forgot to mention, we chose online portfolios related to rheumatology.
Okay.
Rheumatology cases only.
So you picked up a particular topic and looked at only rheumatology, and those patients of rheumatology, the students had portfolio.
Yes.
Okay, good. Go ahead. Very interesting.
This is the data for cumulative totals of scoring in cycle 3. Here we have represented the data in the form of this table, which shows that our cumulative mean was of 10.9 with the highest scores in quarter 3 of our cycle.
What does that mean? So yeah, these are numbers. Now you have to tell us what is the meaning of these numbers.
So the online portfolios presented by students in the 3rd quarter of this cycle averaged a higher score than the other 3 quarters.
So it is marginally higher. 10.8 versus 11.6.
Yes, sir.
Not much. Okay. Okay. So so what? How do you explain this? Why did their scores improve in quarter three? Obviously because of learning.
Yes.
Quarter one they made mistakes. Quarter two they made less mistakes. Quarter three they made even less mistakes. So the scores improved. Isn't it? Can you show us an example of what you actually did with the, how you scored them? Can you show us one particular student's portfolio?
Yes.
Where you scored it?
I personally did not score the portfolios. The scoring was done by Dr. K. Anshul and Dr.
Okay. So you won't be able to show us that.
I can show you the portfolios, but I have not scored them personally.
Yeah, but you know which portfolio was scored.
Yes, sir.
So you can give it a try to score it.
Yes.
Because you're well versed with the scores.
Yes.
Yeah, just show us the portfolio and give it a try. Maybe Janvi's one which is open.
There are links to this Excel.
Oh, there are links. Very good. Show us the link. Great work. Nice thesis, isn't it, Pawan? So our interns are doing very good thesis, and I am hoping all of you will do these kind of thesis. Now you are not taking any ICMR KY project. This is something like an ICMR project, which you can take. Studying your own friends. Yeah, because he did it on his own batchmates. He assessed his own batchmates. And we have opening for assessing 2019, 20, 21. If any of you are interested to assess your own batchmates, we'll give you everything. We'll open up everything. So it is anyway open, but we would want you to write a paper on them. A paper on how they are learning. Prasad. He is a very famous.
Yes,
right. He has already joined post-graduation in dermatology. Yeah. I remember him as a third semester student when he, brought a patient of hemolytic anemia, chronic, because of sickle cell, and he was quite involved in the patient. Okay, yeah, go ahead. So that patient also had a lot of joint, rheumatological problems. What is his earliest work? And this must be his later work.
Yes.
Can we go to the earliest work? Like when he was in third semester, like 2021 now? Yeah, you can actually go there. You click there,
yes.
And yeah, it will come down. It will drop down. It will come. It's waiting. Yeah, this internet is a bit slow, so that's the reason. The archives will drop down here, and you can see starting from the last one. Yeah, the internet is slow. So this is Vara Prasad, and how do we go to his first work?
This is December 23rd, 2020.
Yeah, when did you all start working? As
We started working in
third semester.
Yes, sir.
That was the first time you did it. So, give it a try on that.
Which one, sir?
That same thing which you tried, those 3 lines. This is 2021. Let's go. See that. The other option is to keep clicking down and down. Right. Just go out of this. Go out of it. Now keep going down, scrolling down. Then you will reach the first point. Shoulder pose. Yeah, go down. You see, all of you should be having an online learning portfolio like this.
This one is from October 2020.
But this will go down. Yeah, older pose. So which one was your oldest pose? So you can compare yourself with it. Okay, this seems to be the oldest pose. No, there's more older pose. See, this is exam, April 25. That's the reason there was a spike in that graph. Everybody is doing this. Suddenly, nobody has done any online portfolio in life. They also did it. So everybody just spiked like that. Okay, let's go down. Yeah, 2020, older pose. He is one of the best students in their batch. So we can see that he has done a very good job.
Sir, I think this is the last one.
This is the last. May 15, 2020. Was he in his third semester at that time?
Final year, yes.
So even he will not do it in his third semester. That's a bad example. So, logbook. Achha, this is just a signpost. There are created logbook. But is there anything in that? Let us see. let's go down. So he has seen a 42-year-old woman in December 2021. 20 December 2020. Let's come down. At that time the 2020 guys had not even joined the college. Come down. But 2019 had. Come down. Yeah, you just want to see it. Come down. You want to go to the images. Let's put some images. EEG report. Let's go down. So stages of sleep. Come down. Down. Oh yes, now I remember. You know, this is a US patient. You are going to meet her actually. She is a very friendly lady, and she when this COVID broke out, 2020, isn't it? May 2020. Yeah, so it broke out at that time. I think March was when it broke out, and everybody was paralyzed in their homes. So 2016 batch was the final year at that time, and they had to study for the exams, which would be taken the next year, April 2020. 21 or 20? 21. Yeah. So that's why they started studying for the final year, and we gave them virtual cases to study. And the first virtual case was this US lady. She was a real patient. She is also our collaborator, and she presented herself. What do you see? She is having the intermittent visceral fat accumulation. You see, at one point of time this is like that, another point is like that. Come down. All these pictures taken by her, and let's come down. Yeah, this is a picture of her when she was a child, and she has gone back to her childhood to talk about her problems. So this gives you an idea as to how much the record can contain, the electronic health record. So this is a very, very rich example, a data-rich example of an electronic health record. She had all these problems since childhood, suddenly bloating up, suddenly becoming thin. So people actually put her parents in jail for abuse, child abuse. I mean, they have a very short fuse for doing all this. So when something is happening abnormal to the child, the police will treat you. So they basically, so that was a mental trauma to her. Parents were taken away from her. So she grew up with her grandparents. Okay, let's go and okay. Yeah, so she's looking like she's having this Cushing's kind of a thing. See, she's thin there and again she is bloated up, like a Cushing syndrome. So just imagine, she has managed to pull up her infancy photographs. Although she is probably 30 or something. Come down. Yeah, then she has got other problems. Come down. Yeah, and she's got this problem in her face also, like a malar rash, as you can see. So, okay, come down. Yeah, and then there's a lot of activity, so by our students as well. In fact, your batch, we had a lot of fantastic online activity by the students themselves. Like they used to ask questions and all. Although, yeah, like everybody else, they did on TN. And then we started putting everything together after de-identifying the student. I had a lot of work to do. And come down. Down now. Come down now. So this was also a rheumatology patient, a very, very interesting rheumatology patient. We still don't know the diagnosis. It could be Vara-Prasad syndrome, if we could have known the diagnosis. So, okay, tell us how would you assess him? How did you score him? Or how would you score him? You want to take this one or any other?
I'll take this.
No, take this.
So, coming back to how we assess your online portfolios. In this example, as I mentioned, there are 4 domains in making an assessment. The first one is history data. So I will go through the history that he has presented in this blog and check if he has taken enough history, and which includes detailed history, negative history, and also asking for any relevant clinical symptoms, signs and symptoms. If I feel that he has missed any relevant clinical data, I would deduct a mark and then rate him on that domain.
I am personally against this taking negative history. Although we distracted. Like you really want to know what is wrong with this patient, and you are not really thinking of making a general knowledge diagnosis. You are thinking of what this person has. Now you start saying he doesn't have this, he doesn't have that, he doesn't have this. It's a bit of a distraction. So
it helps us get to a differential.
yeah, it helps you to narrow your thing, but what is the objective of that? Like you are again narrowing it to a general knowledge diagnosis. But it will not allow you to make a discovery. Like this patient. This is a completely new discovery. I mean, she has brought out so many things which are positive, but they themselves are perplexing us. Isn't it? So,
in that way, maybe negative history will be more relevant for an emergency physician rather than.
yeah, you are right. Yeah. When we want a short case and we want to quickly come to a diagnosis and give something, quickly, then that is useful. But here, we really want to know what's going on. That's the reason. Okay, continue.
So coming to the second domain, which is clinical signs and symptoms and physical examination. This is a very detailed history. I can't find any clinical examination history in this example. But what you look for in such cases, there may be skin changes if you're suspecting cushions, like surgery. Or if it's any autoimmune disorder, you would also check for common autoimmune signs. Just now we saw a case of spondyloarthritis, which has a convenient mnemonic, PA, psoriatic arthritis, autoimmune arthritis, so you would check for skin findings and relevant history, relevant clinical signs. If the relevant clinical signs are investigated thoroughly, you will grade them full. Then coming to investigations and lab imaging analysis. She has an MRI CT report and X-ray of a fracture that she suffered during last June. Okay, this is fine, but maybe not relevant to the case. So based on this data, you can grade in that domain and find.
So what do you think? Why did Vara not put the clinical features? What could have?
You mentioned that this was an online case.
Yeah, because he was completely dependent on the patient to share her clinical features. It was a telemedicine case report, so the student here could not actively interact with the patient. Isn't it? Not even like synchronous telemedicine, where you actually see the patient opposite to you and you can talk to her. Not even that. This was the asynchronous telemedicine, where the patient had made the case report and then she shared the data, and then people had to share it. Basically, it was interpretation. So this was not even a proper case presentation. It was basically interpretation. So I think we should move to another one because this was basically just interpretation of data. So yeah, let's go to another one. Maybe the next one.
Yes.
How do you go there? Maybe
I have to click on.
we have clicked on. Yeah, that was made by the patient and sent to us, and then they interpreted. So while interpreting, he could have must have used the data again just to make it look better. So all of your portfolio should look like this. You should have your picture there, and the picture should also be like with your appearance same, like how do you look now, not like a movie star. So, and this is your. This will serve you till your post-graduation, faculty, whatever. This will be there. This is your lifelong portfolio. Throughout your life, you will be needing this. Like see, Bihar is now needing it because he is going to become a faculty in US. So, of course, he'll have to start by becoming a postgraduate there and slowly. But it's very quick there.
Here we can see general examination clinical examination data. This is one of his recent cases, sir. So you can see that he has noted about the patient's appearance and state. He also checked for the common clinical signs of pyrexia sinuses, Then he moved on to vitals. There is no. I was expecting a detailed neurological examination, but
CNS.
Yeah, yes.
Go down. I think it's there.
Since the patient has overwhelming weakness, we need to focus on this area.
Oh, he hasn't.
So that was what we would be looking for.
Yeah, and lower limb weakness, he has not yet put in the diagnosis. He's made it as seizures. Look down. Yeah, provisional as seizures. But what about the lower limb weakness? Did he mention it above? I mean, in the history? What did he say in the history? Yeah. So, ambulances and then above? Above. Notice weight loss when for testing. Okay, there is no mention of limb weakness here. So it's just seizures only since 4 days. Involuntary movement of upper and lower limb. So that is seizure. So you are having involuntary seizures like the upper and lower limbs. Yeah. Okay. So alright, let's go ahead. Now, so that means everything is fine.
Yes.
But yeah, he is not given a detailed CNS exam.
I would like to.
Definitely that will go against him. So we can deduct some points for that. Because we have not mentioned the CNS examination. Alright, go ahead. What else?
Then coming to the third domain of labs and imaging analysis, we can see that he added relevant lab data and also reports.
Yeah, what do you think about this ECG? Anybody? Beautiful ECG. Click on that.
Yes.
This is spot diagnosis. Let's start with the, okay, 2021 may not be able to, 20. Oh, this is not becoming big. You have to right click it and then open it in the panorama. Yeah. Oh, save as, sorry. Or see it. Just click on save. Click on save, it opens. And now you click on that. No, this is good. Yes. But yeah, it's become blurred, but still, the clincher is there, visible. What is the diagnostic place here? Okay, 20 is looking clouded. 19. Look at that. What is that? Arrowhead. What are those arrowheads? Huh? Yeah, arrowhead T-waves. Where are the scenes? Which? Yes, hyperkalemia. That's the diagnosis. Yes, by looking at this ECG, you will see. So, hyperkalemia is one, and the differentials are myocardial infarction, the high takeoff ST segment. All those are the fantastic ECG. Okay, let's go ahead. Did he mention the ECG? Did he talk about it?
Yes, interpretation is not. There is no interpretation of
Yeah, so those are very important. Omissions, I would say. Yeah, important omissions. Yeah, you can click there and look. So, yeah, close that cross. Yeah, okay. Go ahead.
There is no analysis on the labs and imaging data, so that will be a negative
point.
And finally,
go down, there is no discussion actually. There is no analysis and discussion of his case.
Yes.
So you must all remember that unless you ask questions, okay, this is the thing I got, the data. Now how to make sense of the data? I have to ask why this, why not this? So when you say why, where means anatomical diagnosis. Why is etiologic diagnosis. And finally, what is being done? That is the ultimate thing, the solution that will be provided. So based on where and why, we can think of what to do for the patient. So those things have not been analyzed properly. Here what he has said is, somebody is giving him Nicardia, Shelcal, Oropal, Nodosis. What are the use of all these drugs? how does the audience make out? Why is he on? Okay, we know that he must be having hypertension, tachycardia, and why is he on nodosis? Why is he on Shelcal? Why Orofer? That is iron. Yeah, and why duolin? That is Ipraven and Budicol. No, Ipraven and Theophylline. I mean Asthalin, isn't it? Ipraven and Salbutamol. Ipratropium bromide and Salbutamol. Okay, come on. See, fluid restriction less than 2 liters per day. He has written. So, what is this fluid restriction which we should have given to our patient we saw in the ward just now? Isn't it? So, basically to reduce the load on the heart. So, in all probability, this man also has got heart failure. This man has got renal failure, and that's why he's developing hyperkalemia and all that. And those things have not been brought out well. So, yeah, in Vihar's analysis, he may not get a good score for this particular record, isn't it? Okay, now Vihar will quickly wrap up by going back to his study. Before the light fails us.
Yes. I have scored everybody. I have scored a cumulative average and total average scores for each domain, and this data is represented over here.
Tell us your conclusion.
Okay. By gathering all of this data and looking into these charts, we can see a clear improvement in our quality of inpatient care from cycle 2 and cycle 1 comparatively.
Quality of inpatient care or quality of the students' portfolios?
Quality of the students' portfolios which translates into inpatient care.
How does it translate? That is the most important thing we are working on. How to translate the learning points of the students which they are learning into patients' illness outcomes. Like when we learn around a patient, does it get translated to better outcomes for the patient? Does it benefit from your learning? Our hypothesis it does. Because logically, when any doctor treats a patient, unless he learns about what to do for him in a better way, he is not going to be able to improve his condition. Yeah, he may be an expert and he has already learned a lot, and he might just be, reflexively giving him the already known solutions. But is it enough? Is it enough? Yeah, sometimes it may be okay, it may be enough. All the patient needs an appendicectomy, you have removed it, and you close the abdomen, and the patient is just healing on his own. So, in many instances, it may be enough. But in many instances, particularly in medicine, in surgical disciplines, and as I said, in emergency medicine, critical care, you just do it and the results are instantaneous. So, it's all more physical. You don't have to think much, you don't have to learn that much. Whatever you learn, if your body knows, it's fine. But in medicine, there is a lot of intellectual cognition activity going on. Because what in medicine you are dealing with are challenging problems, which are not very easily solvable. That's why they have come to medicine. If they had a solvable problem, they will never come to you. They will just go to somebody who does that intervention. So that is the difference. So that's why in medicine you learn a lot of how to think. Medicine is not associated with medical education. With all your education is how to think. You are not being taught how to do an operation. You are not being taught how to do in a pleural tap or a side tap. No procedures will be there. At the most, we are teaching you how to hit the tendon with an e-hammer, which many of you, in the 2018, many of them failed because they could not. But yeah, so yeah, it may not be translated, but at least you have scored the student, you assess the students. And that's very important. And can you help us do the same with 18, 19, 20? Can you guide them? Can you train them to do what you have done? So you are now already in our group. Which one? The PLAR group.
And in the current interns group also.
Yeah, the ward group. The 17 group. 17. So yeah, you start sharing it there and we'll share the video there. And then we'll invite people to get involved with him so that, and may not be in this way, but this is a quantitative way. This is very much like how we give you marks. So we can even do it in a qualitative way. not giving you marks, but giving you feedback, learning feedback. Okay, very good, fair, and all those things are there, but what exactly better you could have done? What are your learning points, and how can you utilize these? In what way have they been utilized to help the patient? So I think the next part of your project, where all of you can work with all of them, is to how to utilize these learning points to improve the outcomes of the patient, and how to show that they are connected. That will be the next phase of your project, which hopefully we should be able to do. We should be able to do. I mean, with you online now. So should I sign your document now or after you do this? Because if I sign it now, you won't do it. Okay, I'll sign. So yeah. So that's it. We can show the audience now. Yeah, sure, sure. So the audience has this feeling of perplexity in their faces.